Live from Technion webinars with Technion experts.
This is a technology that was developed 10 years ago in my lab. And the idea behind this is a drug delivery system. During this long-term research, we discovered that this delivery system not only interact with tumor cells, but also with the inflammatory part of the tumor. And this part relates to the COVID-19. What we imagined is that because the cells, which we call them MSC, mesenchymal stem cells, the stem cells that we use that knows how to direct themselves to inflammatory tissue, we wanted that these cells will now behave like a decoy for the virus, and I will explain. Once I have these cells, we placed inside the cells a DNA which express on the surface of the cell the receptor or the binding moiety which can bind the virus. If you look at this slide, this is the cell itself, for instance. Once we put the binding moiety that recognize the virus, it would look as this one, like the red will be the binding moiety. Now, we take these cells with this binding moiety for the virus, it's specific binding moiety for the virus, not for any other viruses. And then we render them as ghost, like I explained before, meaning I empty the content of the cell and I leave only the membrane. Now I can fill it with the drug that can kill the virus. The idea is that once I inject this ghost to patient, I will have the ghost, the virus, which is labeled here in green, the COVID-19, will have a problem because usually they bind to the lung cells, which express the same binding moiety. Like imagine this is a lung and we have the same binding moiety. And the question is, where do they go? If I put enough or inject enough ghost, they will bind to this moiety more or preferable than the cellular component of the lung. Therefore, I will have a ghost binding many of the viruses. Once they bind the viruses, these viruses are no longer free to bind the normal cells, meaning our lung cells, and therefore will reduce the infection and will reduce all the severe effect that we see in corona patients. The other possibility with the same technology, now we asked ourselves, can we mimic the virus also? Of course, in this case, don't want to use the attenuated virus or a virus that will risk us in infecting the patient. So the question, can we mimic it without having all the problematic part of the virus? In this case, we took another different measure. We got back the ghost. Now, instead of infecting them with the moiety that attaches the virus, we infected them with the envelope of the virus. I'm presenting on the surface exactly what the virus is presenting. However, I don't have anything here, therefore I can't infect the cells. Once I have it, then I can reduce the size to a nano size similar to the size of the virus. So now I have like virus. Once I introduce it to the body will react and create antibodies against the envelope, similarly in the way that he does to the virus itself. Simple vaccine, not an expensive one. If it works as well as we think it will, then we can start and produce it for the second phase. And by that, we are sharing the part of taking a delivery system that was supposed to or designed for cancer, but shifting it to play a role in the coronavirus.
In the middle of March, we started to create sessions with Rambam Hospital and the Faculty of Medicine in the Technion, where they showing us their needs. And the need was to better protect the teams, the medical staff. And as we saw, between the protection that we use in chemical protection, there is a gap because the protection for medical teams is not sufficient. Even the 95 mask is not sufficient. Specifically working in an intimate distance from COVID-19 patients. We used a system that is based on this manifold. The air going out from this manifold from the forehead in an angles that are changing toward the sides. So better protecting the face, adding protection to the face using this filtered air, using a blower. So adding also comfortability and specifically eliminating fog from those who work in the corona wings. The second version was replacing the screen or the visor with a very simple low-cost hood that is acted upon the head, very low cost, actually disposable one. And both of them was tested immediately. Like after 3 days, we had the first visor printed and tested. A new system of printing, HP printer, who can print dozens of these in like one go. And immediately we started to deliver this to hospitals. Rambam Hospital got 10 units. Carmel Hospital got 5 units and used it. We found out we need covers to the to the blower. This is Bnei Zion Rothschild Hospital in Haifa. This is the vice president of the hospital. And we also sent a few samples to Holy Name Medical Center, New Jersey, and they really loved it. We also got a lot of exposure, first in the Technion and also in the national TV and the Haaretz newspaper. This is an article on how science contribute to the crisis, and we were on top of this article. So this is the system we are now trying to commercialize.